My name is Kurt. I manage programs, mental health programs in a somewhat big healthcare setting, in a healthcare system. Um, One of the programs is a program that provides supports for people with serious and persistent mental illness. And the other one is a sort of vocational based program, helping people find employment, maintain employment. And part of that is there's a residential component to those programs. So when COVID hit, I was deemed essential because I run this residential program, and someone has to keep an eye on things.
And how has that impacted your job?
Well, so a lot of care has gone from face to face to virtual. I would say probably only about 20% of the care I provide has become virtual. Most of it is still sort of face to face. But it's a little different because typically you'll be wearing a face mask and standing apart. So the virtual care is fine for some of the people, but I find a lot of some of the people I'm working with, it's work. And so there's a real quality and value face to face. Particularly for some people, actually healthcare has a social component to it. And so, they might come to appointments and they recognize people and they sort of form some bonds and they talk. And now they're very isolated.
So that has really changed for you in your work during this time?
Yeah. In healthcare, there's been a big push to utilize virtual care for the past 5-10 years, and there's been a lot of resistance, both on the part of patients as well as providers, because it was, without ever trying it, just feeling like it wasn't going to be as good as being in direct face-to-face encounter. For a lot of people who I work with, they've found out that they actually really love it, and the patients actually like it quite a bit as well. So that's sort of been one big change that will come out of it. And that will really, I think, change healthcare. So one of the things that always happens in healthcare, like in most professions, is there's never enough space to do all the things that people need to do. So it's, we need to hire more people, but we have no place to put them. So now people are teleworking. They're doing stuff at their home. And I think that will change how space is considered and how it's utilized.
Wow. And are there any other changes you can think of into the future after this, as this proceeds?
Yeah, well, that's going to be a big change, is more continued virtual care. I suppose, I'm trying to think of the future, but I'm also, things change day to day, responding to the COVID situation. So it's, you try to project out, but then, things change 4 times in a week. And so what you think in the direction that you're going in, turns out that maybe there's some detours or barriers to that. So I think going forward, it's going to be a lot of small trials, stuff that I do. Rather than laying out this big vision, this global plan of how I'm going to proceed from here, it's probably going to be, let's try one thing, see if that works, and test it, and then make the changes that we need to do. So I anticipate that things will be quite different, but I don't know yet what the differences are going to be.
Well, thanks for sharing that with us, and I'm grateful that you're willing to talk to us.
Okay, happy to.
I'm a nurse in California. I work in a prison out here in the central coast of California. My job is as an infection prevention nurse. It used to be called infection control, but infection prevention is more to the point of what I do. Usually, it's the matter of preventing like vaccinations. I mean, not preventing vaccinations, but prevention of disease by using vaccinations. And if somebody shows up with some kind of a contagious disease, you know, we go and assess. We might do a surveillance on the dorms or in the area where the person came from. For example, a scabies outbreak or shingles or influenza, anything like that. So I have been doing this job for under a year, but a really great job. But then when COVID-19 came along, boy, has it changed our job. Everything that I do right now is regarding COVID-19. The real big fear for us at our prison is that it's going to start running rampant within the prison walls. We have one side that's all single cell, and the other side is dorm living, like 50 to 80 guys in a dorm. That's really a terrible, like just like the old people homes or whatever, nursing homes, how that's a place where COVID-19 just can go rampant. That's also the worry that we had about the dorms. So we've been really particular about how we test and where we place people that have COVID symptoms. We had a couple of months of no positives, so we had a chance to kind of work things out. But right now what I do is I swab anybody. Like there's different times during the COVID disease that you want to swab. Of course, when you're diagnosing, but also as the person who was positive is recovering, we're trying to make sure that they're not still shedding the virus. So we'll find it takes 3 or 4 weeks before they even test negative, and then we need 2 negative tests. So there's a lot of swabbing going on. And if you've had it done, it's not a particularly fun test to have, but the guys are pretty informed about COVID. They have a lot, especially in the beginning, they had a ton of fear, and they're pretty cooperative with it. So also I go every day and I assess all the guys on the tier that are isolated for COVID. And I'm involved in other things as well. I keep all the records of who, what, where, when. So, and then there's other infection control things that we do, but most of those are on hold. So that's what my job is and how COVID has affected my job. One thing I wish that people knew, I wish that people remembered that this is a brand new illness. So we're so used to our technology improving how we understand illness, and I mean, myself as well as a healthcare provider for almost 30 years, what I learned the first time I went to school for nursing was really different from when I went back and got a master's. What we knew about our immune system, what we knew about pathophysiology, what we knew about cardiology, that all changed in that interim. And so our technology and our understanding of how the human body works, how diseases are processed, especially the genetic component, is increasing. And we're able to target treatments more specifically to that person, that individual within that disease, like the cohort that has that disease, just to that individual, we can target things. But with COVID, I mean, it's a completely different thing. You know, we're seeing things that we had never really seen. We only have 11 positive patients at our prison, but just in general, considering all the information that's coming in, because that's one of my jobs is to keep up on that. Like the things that we see are very unusual. Like, you know, it changes all the time. It doesn't affect children. Oh, now it does affect children. Oh, it has always affected children. We just didn't understand because we couldn't test. And now we have syndromes that affect children. It only affects the respiratory, and now we know it affects so much more. In fact, this whole thing about the COVID toes, and now that we're seeing a connection to Guillain-Barré, which is a ascending paralysis type of syndrome, that usually would come, we don't really know what the instigating factor was, but usually after some type of respiratory disease or cold. And we're seeing that as well. And so there's so many things that COVID-19 is affecting, and I wish that people could keep in mind that what we knew a week ago isn't what we know now, isn't what we know next week, and kind of be flexible in their mind about the changeability of the advice that's given, and just try to keep up on it. Try not to carry along like what you said, blah, blah, blah. Because for healthcare providers, I mean, we're, in the midst of this really changing thing where we've got scared people, we get agitated people. In my situation, the inmates are completely upset at being like isolated and everything. And I get that. But when we look, I tell them, we're looking out for all of the inmates, even especially the ones that don't have this yet. We don't want it to spread. And if you can make it bigger than that person and their symptoms or lack of symptoms and their particular issues, if they can see how they affect the people around them, if they are positive, I think that will help. So being flexible is a big thing. And then the other thing is one pill is not going to solve this problem. Like we usually go to the doctor and we just want an answer. We don't want to do a lifestyle change. None of us do. We like our lives the way that we have them, but we're going to have to do lifestyle changes for a long time with this. And actually, that's true of health in general. We just try. A lot of people don't like to see that. They just want, they have this symptom or they have this problem and they just want to have a solution right then, and not realizing that all the things that they do connect to their health in the future. And taking a pill will not really change that. And having surgery will not really change that if you go back to the same problem. So, and then how do I think that's going to change the future? I think it's going to be a huge change for the future. This is not the only unusual virus or illness. There's a lot of them, but this one was particular in that, unlike the first SARS and unlike the MERS, it doesn't kill, unlike Ebola, it doesn't kill the victim so quickly, and so, or at all. And so that victim can spread that illness. And, with these much more deadly diseases, the disease will die out because it kills people so effectively, either 30 to 60 or more percent, and that, they have to keep transmitting it to a large number of people for that disease to still be viable, to be spreading. But not with COVID. I mean, COVID, we've had a lot of people in our area that have been completely asymptomatic and didn't know they had it, and we're getting better testing. I live in California. We're getting better testing. Anybody can be tested that wants to be tested now. So, but if you're not symptomatic, why would you go through that test? But we affect each other so much that I think that's how it's going to change the future. The people that are out there that are not too worried about it are going to spread it to other people that they are near. And if you want to avoid this, you're going to have to maintain your social distancing for a long time, even up to a year, to prevent you getting infected by somebody who isn't paying attention to whether they're infected or not infected, and spreading it and not spreading it, doesn't want to participate in that, just magically wants it all to go away. And so our economy, including the healthcare system, is going to be severely taxed with this. And I do hope it leads to the disconnect of healthcare always being associated with work. We're like the only country, civilized or developed country, that does that. And so people that have lost their jobs lose their health care, and that's ridiculous. So I do hope that that's one thing that changes. And that's pretty much all I have to say. Thank you.
Can you tell me what your job is?
Yes, I work for the Postal Service in Berkshire County.
How has COVID-19 impacted your work?
Our scheduled work remained the same. We just take precautions with like cleaning products, the mail trucks inside the building. if we go into businesses, housing complexes, we have to wear a mask. Other than that, everything has remained the same. There's not much to change.
What is one thing you wish people knew about working with or during the time of COVID?
Again, I guess in my line of work and what I'm doing, there's not, as far as like my route and how it's set up, I guess nothing changed. And with that being said, I guess there's nothing that I know that maybe nobody else knows. Does that make sense?
Sure. And
Okay.
how do you think COVID-19 will change things for you or others in the Postal Service in the future?
Same thing. I think we just will have to be better with cleaning, maybe keeping distance from people, depending on when things get started back up, there may be new rules or regulations that we're not even aware of yet. But as far as right now, I think it's mainly just cleaning and keeping distance.
Thank you.
All right, you're welcome.
I am a nursing assistant at a nearby hospital, and I have also recently graduated from nursing school.
Congratulations.
Thank you.
So how has COVID-19 impacted your work?
COVID-19 has definitely added some added stress. I'm actually a float nursing assistant. So with that job title, when I walk into work, I don't know where I'm going to be in the hospital or really what my duties are going to be for the day. So that's added stress, like on a normal day-to-day, like am I going to be in an ICU or in a regular unit? But since COVID has started, I've found I've been way more stressed going into work, not really knowing, am I going to be on a COVID unit exposed to all of this, or am I going to be just doing what I usually do when I go to work? So that's definitely been something that's a little fearful these days. But I think with that, also while I'm with these COVID patients, it's been very different. The way I work with them, we've been advised kind of to limit our exposures. So there's been some emphasis on clustering our care, which is definitely different because I'm one of those people that just likes to pop in and like check in on my patient. Hey, how are you doing? Can I get you anything? So it's very weird to be like, I'm here now, like, what can I do while I'm in the room? Especially when they don't have family members. So those human-to-human interactions is really helpful and beneficial for their care. So it's kind of sad to feel myself saying, like, I can only do so much. Like, I've already been in there 10 times today. Like, I really shouldn't go back in. So it's a weird feeling for sure.
What is one thing that you wish people knew about working with or during the time of COVID-19?
I'd have to say the loneliness that I can see in these patients. Like I said before, we're clustering our care, so we're not in the rooms as often. So there have been so many times where I've walked into a patient's room and they're like, "Can you just please just sit with me for a few minutes? Like I'm so lonely. I haven't talked to anybody all day." And you could just see they're just like itching for that like human to human interaction, which I'm sure we all are, like sitting at home. But definitely, like, I would advise people, like, if you have somebody in the hospital or you know somebody in there being treated, to call them and just check in with them and have a nice conversation with them on the phone, because I really think that helps them get the hope that they need to fight this virus.
How do you think that COVID-19 will change things for you or for others in the future?
From a hospital standpoint, I would have to say, like, as it is all over the news, the PPE, things have definitely changed. Like, we're used to the hand hygiene, the gloves, and everything, but in terms of like the masks and the gowns and how often we're disposing of them, that's definitely something that has been very different that I haven't seen in the past few years of working in a hospital. So I do see us like consistently wearing masks for every patient and interaction, which is definitely something that will change. And I think that might carry out out in the public as well. So that'll be a new normal.
Sure. My name is Marie, and I work for a large specialty clinic in central Massachusetts. I've been in my job role for the last 19 years. I'm based in a large hospital setting. In my position, I'm an administrative person, not a frontline worker. I am the assistant to the director of all the non-specialty departments in that hospital. We have 11 specialty departments and about 80 physicians that I support on a daily basis.
Okay, good. Can you talk about how COVID-19 has impacted your work?
Absolutely. Because I have such a variable role where I could be working with any one of the 11 practices that I support at any given time on a variety of projects, I'm used to toggling back and forth between things that arise at any moment, but it has certainly been challenging. Two of my departments are the pulmonary/critical care department and the infectious disease department. And both of those departments obviously have been very busy and at the front lines during the pandemic. Our pulmonary and critical care physicians staff the ICU at the hospital, and the infectious diseases department is responsible for coming up with all the protocol that all of our 3,000 employees in our company have to go by for safety and sanitation reasons. So I've been very busy supporting both of them, developing respirator and medication guidelines. I've also been very busy. We have a urgent care facility just down the road from our hospital, and we decided to convert half of that facility into a 40-bed unit that could house patients who do not have COVID. So we decided to move some of the patients that had been admitted to the hospital for a variety of illnesses and reasons, but they did not have COVID. We moved them to that unit so that they would not be exposed to COVID patients, and to open up beds to patients who did have COVID in our hospital. So that was a large undertaking. I've also been busy helping our physicians. A great deal of them have volunteered to help staff the DCU Center COVID unit, which has now since shut down. But one of my projects was getting our doctors approved to be able to staff that facility because they were understaffed. So every day, different projects that are related to COVID arise that are unexpected, and we have to be ready to bend and change and take those on as they come up.
Okay, thank you. What is one thing you wish people knew about working with or during the time of COVID-19?
I wish that people, when they talk about medical frontline workers, I wish that they would realize what a village it takes to run any medical group or facility. Our doctors and nurses have been just exceptional and just instrumental in manning the front lines of this pandemic. But it also takes a very large behind the scenes crew of people, from housekeepers and dietitians to IT people, administrators, couriers, just to keep things up and running, because throughout the pandemic, we have also maintained care for other patients. It hasn't just been the COVID patients that require care throughout the last 2.5 months. So to keep that up and running and as seamless as possible for our other existing patients, it has taken so many people. And it's also been very challenging with some of our staff working from home, others of us on site in our offices. Some of the staff have their own exposure issues to COVID or childcare issues. So of course we're running partially staffed just like any other organization, and very challenging to coordinate all of that care. I would want people to know that even if you're not at the very front line, if you're in healthcare, you most certainly see and feel the effects of COVID on a daily basis. For me, I am based out of the hospital, and we only have one entrance that all staff in the whole building can come in and out of, and that entrance happens to be next to our loading dock. And about a month and a half ago, they brought in a refrigerated truck. Nobody thought anything of it, and then we started to, as staff came in and out to work, they would roll deceased patients past us that had passed from COVID, and they would load them into that truck. And I remember the first day that I saw that happen, and I got to my car and I cried afterwards, because it just hit so close to home, and you realize that that person probably passed away without their loved ones next to them, and you realize that that was the first patient that I had witnessed, but it was going to be the first in the line of many. And since then, you kind of become numb to it. We see that happening every day in the hospital, and it's a very somber atmosphere that we work in right now. It had been a great, positive, upbeat, we're all in this together vibe in the beginning. And now it's become quite draining for all of us. So I just wish that people would realize how every single person that works in a healthcare unit has been greatly affected by this, and that they're the strongest group of people that I know.
Excellent. Last question. How do you think COVID-19 will change things for you or others in the future?
I think that this pandemic has already started to influence us now and how we will live in the future. I can foresee people in all industries maybe converting to, working at home on a permanent basis, at least 1 or 2 shifts a week. I think some people have decided that maybe they like that, the telecommuting instead of going into the office every day. I do hope that what we've learned from the pandemic is that we learn to support better our local businesses in the future. We've learned how fragile just 2 months of this situation can be to so many people. So I hope that we continue to support our local businesses and restaurants, and to better appreciate what we have in our loved ones while we have them here. It's such a short amount of time that has passed, and yet our whole worlds have been affected by this, changed. And I hope that we reflect a little bit more on our behaviors and reactions to things. In the beginning, we were much more united, I think, and over the last few weeks, the stress of all of this and the fact that this has stretched on so long has really gotten to people, and people have been sad, anxious, desperate, lonely, and maybe they act out in certain ways because of that extreme stress. And notice that just people are grouchier and snappier, and I would hope that we would learn in the future to show more kindness, more patience, respect, and to show help for others. I think so. You never know what another person is going through.
Wise words. Thank you very much, Marie. Really appreciate it.
All right, go ahead.
All right, my name is Christina, and I'm a registered nurse.
How has COVID-19 impacted your work?
It's turned it upside down. it's made it very hard to do things at my job. I work inpatient on a medical floor, and it's made it incredibly difficult. And it's taken a lot of joy out of my job, out of bedside nursing. It's made us all very, very anxious and worried and angry and upset.
So what is one thing you wish people knew about working during the time of COVID-19?
I wish people knew how serious it was. I get very tired of hearing that it's a hoax, or that that doctors and nurses like stand to lose a lot of business if the virus goes away, or whatever theories. It is like such a serious, sad, horrible thing. I'm sorry, excuse me. I said it, I guess.
How do you think COVID-19 will change things for you or others in the future?
I mean, I think it's going to make my job a lot harder. I think especially as we get into the fall, and we always have people come in and, we don't know if they have pneumonia or the flu or RSV, and now we're going to be worried about COVID again. And, that's really scary. The fall is going to be a really scary time at my work. And then just trying to figure out how to keep my kids safe. I have young kids, and there's new cases coming out with children involved, and that's really scary. But trying to figure out what's worse, having them stay home all the time and maybe be safe, or go to school and get an education. So I think it's going to change a lot. It's very scary.
Anything else you would want to tell people?
I mean, I think people just need to realize how serious this is. And I kind of had it in my head when this started that we would be saving a lot of people and helping a lot of people recover from this. And actually, what my role has been more is just helping people pass with dignity and with comfort. And, it's a big deal. So, yeah, I want people to take it seriously.
Well, thank you very much.
I'm Robin. I'm the church leader for music at the New Hope United Methodist Church, which is a Methodist church which serves Methodists in northern Berkshire County of Massachusetts.
And how has COVID-19 impacted your work?
When the virus began to be recognized in our county, churches across our area ceased having in-person worship services. So that was at the beginning of April, and we had our last worship service just before Palm Sunday. So since April 5th, we have not been together to worship as a congregation in person. We began having online gatherings, and the pastors used technology through Facebook Live streamed services and also through Zoom to gather all the members of the church together to have what would have been a regular worship service with prayers, music, sermon, scripture, and social time together.
And what is one thing you wish people knew about working with or during the time of COVID?
So it's been a sad time for people who would normally consider their congregation, a place of support, a place to celebrate, to practice their religion together. But we are trying to find ways to continue doing that virtually. It has been somewhat successful with some frustrations because there are some members of our church who do not have the technology or the skills to connect via these online platforms. And some of the other impacts have been it's difficult for churches to continue their financial requirements because usually churches collect contributions at the Sunday worship service. So that also has been a feature that has had to become virtual through contributing online if you are a member and you pledge a certain amount to donate each week. One thing that impacted me directly was that we can no longer have choir rehearsals. As the music leader, I would have weekly choir rehearsals preparing music to be sung in the service. But since choir, particularly, as you may have read, there was a large outbreak of COVID-19 in a chorus that rehearsed where many of the members became infected, and the scientists and physicians have told us that the virus is more easily shared when you sing because it's an energetic breathing involved. So we are not allowed to have any choir rehearsals. And even when we resume having worship in person, we will not be able to have any singing, no choir anthems. We can't have, the Methodist Church has given out notices that you can't even have musicians that would be playing a wind instrument such as a trumpet or an oboe or a clarinet. So it will be very different to not have singing as part of worship.
So what is one thing you wish people knew about working with or during the time of COVID?
Well, particularly for this area of my work as a church musician, despite having to worship differently, the church is still trying to find creative ways to continue fulfilling its mission. One interesting aspect about my church is that we have a community garden that has been in place for several years, and it produces a lot of food, which is given to food cupboards in our area for to help solve issues of food insecurity. So we are continuing to plant and nurture that garden this summer, and we will be using volunteers who come to work in the garden, weed and water and maintain it, and keep the produce from it to be distributed. We are following the Purdue Extension Safe Practices for Community Gardens. So this is a new regulation that we have to follow, but we're still able to do some outreach to the community through providing food for the hungry and doing it by practicing safe practices.
And finally, how do you think COVID-19 will change things for you or others in the future?
Until we're able to safely be together and worship in the traditional ways by singing together, which is a activity that many churches of all denominations and faiths celebrate and worship through song, and to not be able to do that as a community in a group gathering will be frustrating for many. We'll have to look for ways to find new ways to express that without vocally, risking our health.
Thank you for your time.